Good afternoon. Today, North Carolina Department of Health and Human Services Secretary Deb Sangvi and I are here to talk about the urgency of fully funding Medicaid. We're pleased to be joined by Dr. Karen Smith, a family physician who cares for patients receiving care through Medicaid, Betsy McMichael and Demi Eckhoff, who are both advocates for people with disability. I'm grateful to each of them for sharing their experiences with Medicaid with us today. But first, Secretary Sangvi, I'm going to turn it over to you, Secretary.
Good afternoon. Thank you, Governor Stein. Thank you for your leadership and commitment to the health and well-being of all of North Carolina. And thank you to everyone who is here today. North Carolina has worked for years to build a fiscally responsible, world-class Medicaid program that so many rely on for life-changing, in many cases, life-saving care. North Carolina Medicaid is innovative and provides affordable health coverage, access to doctors, prescriptions for more than 3 million individuals. These are children, older adults, people with disabilities, veterans, and working North Carolinians. These provider rate cuts are devastating to people, providers, and communities. Implementing these cuts is one of the hardest things I've had to do in my professional career, as a hospital executive, as a provider, and as a member of the North Carolina community. I know how important provider rates are to systems of care. As we have said many times, we did not make these cuts easily. This was an extremely difficult decision for us and a difficult decision for North Carolina Medicaid. However, without additional funding from the General Assembly, it was simply unavoidable. If we did not implement these changes, the financial strain on the Medicaid program would be even greater, potentially jeopardizing stability of the entire system and putting the state at significant fiscal risk. North Carolina would have run out of North Carolina Medicaid funds as early as next year. Here's the bottom line. North Carolina Medicaid is a critical driver in the health of North Carolina and makes people healthier. We know that. We have the data and evidence to prove it. We want to protect people's health and make it possible for everyone to get the care they need when and where they need it. No one should have to worry about services going away. We all agree that Medicaid needs to be fully funded. Let's come together and get it done. And now, pleased to introduce Dr. Karen Smith, someone who's living the reality of these cuts every day. Dr. Smith?
Thank you, Governor Stein, for allowing me to come and share some of our observations. I actually want to convey words of optimism. As a family physician of 33 years, one of the things that we've come to learn, optimism is sometimes all we have, and that's what we go by. But I'm encouraged because people have access to comprehensive, quality, coordinated care. And we know for the first time, a young mother who had good prenatal care, did everything she was asked to do, but found herself with an infant who had lifelong congenital problems. And to be able to sit with her and give her that encouragement to help her navigate through a system that clearly was going to be challenging. We also had the opportunity of working with a caregiver who kept repeating, thank you, for allowing my friend to actually live to the end of life with dignity because of those conversations that were held, the relationship that was established. And to be able to transition in peace and not get services that, quite frankly, he did not want. And what about the young man who showed up in our office on Monday with a constellation of symptoms? He couldn't figure it out. He didn't know what was going on, but he knew that he could go to a doctor's office in his community and then to come back 5:30 in the evening, well after the office had closed, to find out that he has a life-threatening problem and coordinate his care, get him to the emergency room. But here's the kicker. He came back in the following morning and said, hey, doc, I told him I don't want to stay at the hospital, but I need you to fix me up so I can go to work the next morning. Those are the stories that we share. This is enough to show the optimism that if we can make the right decision, people can continue to have access to their physicians, access to their health care providers. That's going to make a difference in their life. Now, medicine has moved forward. We have certainly brought forth advances in health care, but We're keeping people at front and center. And the only way they can do that, be with us, is to have that access. Well, I'm truly optimistic because I see people becoming healthier and happier every day, and they're thriving in ways that we've never seen before. Medicaid is a lifeline from the very beginning of life down to the end of life. And we look forward to the support to make sure that people can continue to thrive. I'd like to turn it over to Betsy.
Good afternoon, everyone. Thanks for being here. I'm here to tell you a success story, but one that feels increasingly fragile due to threats to Medicaid. I stand in a long line of mothers before me and among thousands now in North Carolina who are raising loved ones with serious conditions. Our daughter Janie is 33 and lives with an ultra-rare neurodegenerative condition called CAND. It comes with many challenges. But here's the beautiful part. She also lives in an apartment she rents in downtown Durham, in a neighborhood with people with and without disabilities who share life, neighbors helping neighbors. Janie rolls to coffee shops, to the YMCA to swim, and even to her polling place recently to vote. She has friends over and works as a consultant with a dance company. But here's the other reality. Her condition comes with a lot of medical issues. Thankfully, she's got a great primary care doctor, neuro-ophthalmologist, physical therapist, neurologist, urologist, geneticist. You get the picture. Medicaid is her health insurance, but it also literally keeps our daughter alive and living well in the community. But Medicaid is more than health insurance. It also provides her with the supports the supports she needs to live her life as independently as possible through what's called the Innovations Waiver. For 9 hours a day, she gets the help she needs to cook, shower, dress, check her email, take her meds, get to appointments, and work, to name a few essential ways it helps. Now, you may hear that threats to her way of life don't include cuts to people like Janie, only to provider rates. But please understand that as those rates are cut, Janie will likely lose her staff workers as their wages drop, or providers are forced to close their doors. It's like saying, we're not closing schools, we're just cutting pay for teachers and principals and cafeteria workers. Without Medicaid health insurance and community support, home and community-based supports, now and especially next year when federal changes reduce assistance to North Carolina, Janie cannot live on her own, work, or enjoy her 30-something life. She would lose the independence she has worked so hard to get. I've worked for over 51 years and retired just a few months ago. As aging parents, we thought we had things in pretty good shape for the day that we're no longer here. But now, truly, it feels like a house of cards, ready to collapse. We each one, every one of us, have just one precious life. Janie's living hers the very best she possibly can, even with a really great sense of humor. No one lives in a vacuum. Everyone needs help with something. So I stand with Governor Stein and ask you and the lawmakers to be smart, to be kind, and then to be proud of making laws that make success stories like Janie's possible for her, her neighbors, and for thousands of families across North Carolina. Thank you. I turn it over to my friend Demi.
Good afternoon. I am here today because North Carolina Medicaid is critical to my health, independence, and life. I don't want the cuts to Medicaid force me or anyone else into a hospital or a nursing home. to get the supports they need. I was born with a rare form of congenital muscular dystrophy. I rely on a non-invasive ventilator throughout the day, as well as a feeding tube for all hydration and supplemental nutrition. I moved away from my family and all natural supports, but my life now is here in Durham, North Carolina. I am employed as a registered dietitian and serve patients with disabilities while also working on my doctoral degree in public health. I am able to pay taxes now, as well as be a productive and influential individual in my community. My direct support professionals, known as my DSTs, are my lamp to the world in my community. They assist me with all daily living activities, such as feeding, hygiene care, toileting, moving me into my wheelchair, driving me to various appointments, assisting me with my medical equipment, and much more. Most importantly, they help me be a productive citizen in my community. A 3% pay cut translates into potentially losing my direct support professionals, which threatens my independence. Ultimately, if non-Medicaid labor services have further cuts, I am at risk for going back into the hospital. In a hospital, I am unable to work and pay taxes or be able to work on my doctoral degree. Today, I am here representing the disability community at large. My DSTs are experiencing a 3% pay cut, which they can't afford. But other DSTs are getting an 8% cut, and many Medicaid services have gotten a 10% cut. I am also losing the type of personal supplies I need, and my doctors are getting cuts too. I don't know what this means if I will lose my doctors. Our disability community is fearful that these cuts will impact our basic needs in life. I urge you now to recognize this marginalized community and eliminate any further cuts. Thank you for your time and concerns.
Demi, Karen, Betsy, thank you all for sharing your powerful stories. If we don't adequately fund Medicaid, there will be many people losing access to health care, particularly in the rural parts of our state. As both Ms. Eckhoff and Ms. McMichael shared, Medicaid can be the difference between independence and institutionalization for so many vulnerable patients. It can be the difference between care and no care for children, including those with autism, women about to give birth, older adults living in nursing homes, people with disabilities, and working North Carolinians. Our state's Medicaid program is in crisis, manufactured by our General Assembly, and people are suffering. Fortunately, because the General Assembly created this crisis, it can solve it as well. That's why I'm calling on the General Assembly to come back to Raleigh to do their jobs and fully fund North Carolina's Medicaid program. North Carolina is facing a healthcare crisis because the General Assembly has not adequately funded Medicaid, and our people are suffering as a result. DHHS warned the General Assembly for months about the impending Medicaid shortfall and said that without adequate funding, the department would be forced to cut reimbursement rates to healthcare providers, giving patients life-saving and life-enhancing care. DHHS and I urged the General Assembly to fill the breach, delaying the proposed cuts for the first 3 months of this fiscal year to give the General Assembly ample time and opportunity to make Medicaid whole. In September, each chamber passed a Medicaid funding bill. They agreed that Medicaid needed more money. They agreed on the amount of money, but they would not agree on a bill to send to my desk. As a result, the cuts to healthcare provider rates went into effect on October 1st. I then informed the legislature that DHHS could reverse these cuts if they would send me a bill funding Medicaid in their October session. The House sent the Senate a clean Medicaid funding bill, but the Senate rejected it because of an unrelated political dispute. By the way, I agree with the Senate on the substance of that political dispute, but it is absolutely wrong and frankly cruel to use sick and vulnerable people as a bargaining chip on an issue entirely unrelated to Medicaid funding. The members of the General Assembly have had 6 months to take action and solve this problem, but they have failed. They have failed North Carolina. They have failed the people of North Carolina. And now they have packed up and left town ostensibly until next year. It is shameful. I want to zoom out for a moment to talk about the broader context on this moment we find ourselves in. First of all, healthcare costs are not going up just in North Carolina. They're going up everywhere. Our neighbors in Virginia said this week that they will need an additional $2.8 billion for their Medicaid program over the next 2 years. Fortunately, in North Carolina, we have an exceptionally well-run Medicaid program. Only 2% of all funding goes to Medicaid administration. Only 2%. That's much lower than most or almost every private insurance company. In fact, North Carolina Medicaid costs are growing at 25% less than the national average of healthcare inflation. They are doing the best they can in this very difficult environment. A second constraint facing North Carolina is the legislatively created fiscal crisis. We're talking about Medicaid's underfunding today, but we will keep running into funding gaps because the legislature has doubled down on its tax breaks for big corporation and wealthy North Carolinians. These tax breaks are not just hurting our ability to pay for health care, they also impact our teachers, our roads, our public safety. Imagine that we're all in a bus together. The legislature is driving that bus straight to the fiscal cliff, and they are hitting the gas. The federal government just cut Medicaid by $1 trillion. With a T, $1 trillion. We in North Carolina over the next decade are going to experience $50 billion in cuts in former federal support that we used to get that we will no longer get. So we now have 3 things happening at the same time. Healthcare costs are going up across the nation and to a lesser degree here in North Carolina. State money that we have available to invest in our people is going down because of these pre-programmed tax breaks. And the federal government is abandoning sick and vulnerable people across this country. This combination spells tragedy for our people. While we need to address these imprudent cuts at some point soon, funding Medicaid today to keep our people from suffering today is why I am calling our legislature back to session. Every one of us in elected office should care deeply about the health and well-being of the millions of people who call North Carolina home. Yet these cuts hurt the people who have put us into office to serve them. More than 1 in 4 North Carolinians, 25% of the state, get their health insurance through Medicaid. In several of our rural counties, that number goes up to 50%. 50% of the people get their health insurance through Medicaid. There are thousands and thousands and thousands of stories just like Ms. Eckhoff's, just like Ms. McMichael's, all across this state. People who are waiting for an appointment with a provider. Patients who are living in fear of losing their kid's doctor. Patients who are waiting on pins and needles for this General Assembly to act. We cannot keep them waiting any longer. And to be clear, the pain of inaction is going to be felt by everyone in this state, whether or not you are on Medicaid, because when providers close their doors, those doors are closed to all of us. Right now, it's getting more expensive to make it in North Carolina. The price of groceries is going up. SNAP benefits this November are being cut dramatically by this administration. ACA health insurance premiums are skyrocketing. Too many people are getting kicked by their government while they are down and in need of a helping hand. In North Carolina, we do not have to be part of that. When people are counting on us to take action, we can and we must answer that call. Let's fund Medicaid and give people the peace of mind and access to care that they deserve. Put away your unrelated political disputes and do the right thing by our people. Thank you. We will be happy to take questions, and you can feel free to address them to any of the speakers. Yes, Gary. No, I'm calling an extra session. Yeah, it's for Monday, the 17th of November. I'm calling them back for an extra session, as is my right under the Constitution, and it is to address the issue of funding Medicaid. Last week. It didn't go as well as I wanted it to go. I want them to do what they know needs to happen. Both chambers agree that Medicaid is not fully funded. Both chambers agree that we need more money and how much money to give. But what they cannot do is come to agreement on a bill because of a dispute on an unrelated issue, which, as I said, I actually take the side of the Senate on. But this is not the time or place to fight that fight. That fight should stay in the overall budget negotiations. It is time to fund Medicaid, because if they fail to do so, people are suffering, and it is unacceptable. I have absolutely no idea what motivates people. All I can look at is objectively where we are. And in the last session, the House sent the Senate a clean Medicaid funding bill, which the Senate refused to take up. I'll take a first stab and then hand it to you, Dev. Dev Sangvi, our secretary, has spent his entire career trying to make people well, to keep people healthy, to improve their quality of life. The concept that he is instituting cuts for a political purpose is ridiculous. We care deeply about the health and well-being of the people of North Carolina. We are desperate to restore the funding levels to where they were before. But by law, we cannot spend money that we do not have, nor should we spend money that we do not have. The legislature has not fully funded Medicaid. They know they've not fully funded Medicaid. It would be absolutely reckless were we to spend money knowing that we're going to run out of money at some point next year, because if they don't come to a deal, and by the way, there's no guarantee that they will ever come to a deal. We're one of 2 states in this nation that don't have a budget this year. But we're the only state in the nation where the 2 chambers cannot agree are from the same party. What guarantees do we have that they will come up with a budget next year? There are none. So we cannot budget based on hopes and prayers. We have to budget on action, and they have not acted.
Thank you, Governor. We've said pretty clearly many times the shortfall is roughly $319 million. We understand that that's a large amount of money. We've been able to break it down and exactly demonstrate where those dollars would be allocated when appropriated. And so what we're really at a point now is if we don't get those dollars, we're going to have to continue with the rates because we cannot spend money we don't have. We've often used the phrase, we can't put these costs on a credit card. So we're $319 million short to be able to meet our Medicaid obligation for this year.
I've been asked, before I knew what the results of this election were, I've been calling on the House and the Senate to act. So the election results are absolutely immaterial to this matter. People are going to be without care. There are doctors who can no longer provide to serve patients on Medicaid. There are going to be entire healthcare systems and programs that cease to be available to people who are in desperate need. People's lives will be worse, people will be sicker, some people will die. They must come back and solve this problem. They can. And when they do, they will be heroes, and I will champion them as such. There is a Medicaid contingency fund. The legislature has written the law so that I can't access it without them making an additional appropriation. I would welcome them changing the law. In fact, I suggested to them, modify this law, let us grab that money for this one-time use. Now, it would create a greater fiscal hole going into next year, but at least at that point, we would have had enough money in the account so that, as the Secretary said, we wouldn't be spending money on a credit card. We would actually be using a debit card and drawing it out of our bank account. Let's pray. Let's pray. I want the people of North Carolina to know that if they care about the vitality, the vibrancy, the effectiveness of our Medicaid program, that they need to reach out to their representatives. They need to reach out to their senators and say, it is time to set aside unrelated political disputes. Let's fix the problem. We all know there's a problem. We all agree there's a problem. Let's fix the problem. So I ask the people of North Carolina, let your voices be heard. Call your senators. Call your representatives. Say it is time to get the deal done. Thank you. Yes, Adam.
Happy to take that. So the question we had is how many providers have said they're not going to provide care? It's hard to quantify that right now because our best evidence on providers stepping out are them telling us the stories, the daily emails. We have now started to get emails from large practices and large providers that have given dates certain by which time they will exit Medicaid. Many of them are calling the end of this month, the time period that they will exit the Medicaid program. A handful. I mean, it's hard to tell because these are practices and they're multi-location practices with multiple providers. But there's a domino effect with that. If it's a specialty practice, for example, and you're a primary care provider, it's going to impact your ability to deliver care even if you're still seeing Medicaid because you don't have access to specialists in Medicaid.
Thank you.
Thank you. Thanks, everyone.